Good evening, everyone. My name is Oriana, and I am a mother of four and a guardian to my niece who is 17. I am the Affordable Childcare Organizer at Mothering Justice, and I want to welcome you all here tonight. You are joining Raising Justice, a celebration and call to action to our other mothers. This event is a Tele-Town hall and a Facebook Live to celebrate our other mothers or those who care for our children and to build political power together. We have some amazing people joining us this evening. I want to introduce our dynamic champion for childcare, Congresswoman Brenda Lawrence. Congresswoman Brenda Lawrence represents the Michigan's 14th congressional district that includes a portion of Detroit, the cities of Southfield, and 16 cities located in Oakland and Wayne counties. Congresswoman Lawrence and her husband, MacArthur Lawrence, are the proud parents of Michael and Michelle. They also adore one granddaughter, Asia. She has been and continues to be a champion for childcare, and we are honored to have her joining us today to talk about childcare in Michigan. Welcome, Congressman Lawrence. Thank you so much for joining us tonight.
Thank you so much, and I do adore my granddaughter. I am so proud to have received your invitation to speak to you tonight because I truly believe that the soul and the moral compass of this country rest on the shoulders of women. And to add to that, the women who go through the parenting experience, like you who are being a guardian to a child, ones who give birth, ones who adopt, we know that when we look at improving the quality of life in America, if we improve the quality of life of women with children, the whole country responds at a volume that is needed today. I want you to know this event is very important because it's about celebrating the women who care for our children. And it's a call to action to invest in them. Child care is out of reach for so many families in Michigan and across the country. Those of you who are actively parenting, I did a town hall on child care, and a father wrote in the message, Congresswoman, I pay more for my mortgage than I do for child care. Too many people cannot afford it. I know many women who've told me I work two jobs, one to pay for child care, and the other to put food and shelter for my children. So we in America, we have a call to action to make that better. 44% of people in Michigan live in what we call a child care desert. It's worse for Black and Latino Michiganders. For instance, for an infant and a 4-year-old, it takes nearly 1/5 of the typical family's income to pay for childcare. Because it's so expensive, many parents, particularly women head of households and women of color, are having to choose between a paycheck and taking care of their child. Women are leaving the workplace at a higher rate, and they're not seeing the effects of our economic recovery. That's why I want everyone to know when we're fighting for the Build Back Better and we're talking about investing in childcare, think about the number of women who will be able to return to work, the number of women who would be able to work and still provide for their children. Because we have seen an exodus during COVID of women in the workplace, and we're not seeing that return. And it's very troubling to all of us. Women of color disproportionately make up childcare workforce. So in the most white community, you'll see people of color caring for the children in childcare. And childcare workers are our kids' other mother. You know that if you ever had childcare. We try to find the best one we can because we want them to care if they have a runny nose. We want them to care if when they take their first step, unfortunately, and we don't get to see it. We want the best for our children. And one of the things that's so perplexing about America, we said our most precious in this country are our children. We said we'll walk through fire and snow, whatever we have to do for our children. but we disrespect the people who care for them, the child care providers. And we need to pay them a wage that it will allow them, we call it a living wage, to be able to care for their children. And I was close to Aretha, and I often, when I'm talking about this, say, all they're asking for is a little respect. Respect for the fact I'm taking care of your elders. I'm taking care of your grandma and your mom and dad. But you send me home and know that I can't even live off the salary that's being paid to me. The same thing with our children. So our economy can't run without them, and we can't expect a full economic recovery if we don't give the resources to them that need to do the work so that we can go to work. The Build Back Better agenda boosts the compensation of our care workers. And in my role as the Democratic Caucus Chair and Vice Chair of the Black Caucus, I'm fighting to pass this transformational bill. We have a once in a lifetime opportunity to build back better with women and with women of color front and center. So the Congress expanded the child tax credit. So all the mothers, you understand that. When we passed the American Rescue Plan back in March, we're putting money directly in the pockets of hardworking families every month so that they can build back better, so they can have the quality of life that we need and want for those caring for our children. In my district alone, that's the 14th district, the child tax credit is lifting nearly 11,000 children out of poverty, just with that child tax credit, where parents are receiving that little bump in their home so that they can buy food, that they can pay for that child care worker. So I'm focused on including historic investments in child care, home and community-based services, the child tax credit, and universal pre-K in the Build Back Better. Moms, you know that the critical point in a child's development is that preschool, and that study after study have shown if you invest early in a child's development, regardless of the social barriers they may confront, they are almost equal and just as ready to compete educationally because they've gotten that pre-K education. Just like we mandate that K through 12 is necessary for us to build a workforce, we also know to give that extra advantage to children at all economic levels, mandatory pre-K is something that we must do. I want you to know, as a member of Congress, I will continue to prioritize childcare and the care economy and the Build Back Better. But I need all of you. I need your voices, and I need to know, I need women and mothers for justice to be with me every step of the way, using your voice, marching with your feet, writing letters, having the phone calls, and doing what you're doing now so that we can build back better and with women front and center. And I'm honored to be in this fight with you. Let's get it done, moms. Thank you so much.
Thank you so much, Congresswoman Lawrence. I am so thankful for your time this evening. I know you said you didn't have a whole lot of time to spare, but we thank you for this moment. That was super powerful. It's really funny that you even mentioned Aretha Franklin. Earlier today, One Fair Wage had a rally out there today, and her grandson, Jonah, was out there singing. And
Oh, wow.
his grandmother, and it was just really beautiful.
Yeah.
I actually went out there to speak about exactly what we're talking about this evening, that childcare workers have been completely disrespected and completely invisibilized when it comes to the economy here in this country. We've decided that they don't matter and they have nothing to do with economic growth, but we know that that's not true. So thank you so much for your important words. And I wanted to ask you one question before you left.
Yeah.
Recently, we had gotten some intel that maybe there might be some cuts to the original number of $450 billion for childcare through negotiations. What do you think we can do to make sure that doesn't happen?
So what we need to do is keep saying that number and why we're saying that number. one of the things that we're seeing in the negotiations that is ongoing, making sausage here, is that we were funding for 10 years. If we cut it shorter, say 5 years, that's a way to reduce that number and make some people happy so we can get it across the finish line. Another thing is they said maybe to look at weighting it. So people with certain income levels would be eligible for it and not everyone. So, and then, we had the discussion about 7% of your income as being one of the ways that we can make sure that everyone is getting an appropriate amount of support, and people who don't need it won't get it, but 7% allows women with higher wages to pay into the resources so that we can give to those who have less.
Absolutely. Thank you. So like, I know at Mothering Justice and our partners and our relationships in the community, we have continued to push that number, 450 billion. We're shouting it from the rooftops. We're letting people know what that number really can mean for the childcare industry here in Michigan. And I definitely want to thank you again for joining us. We so appreciate your champion this issue. It's very important to mothers across the state. Thank you so much for all your hard work.
And thank you. I had the opportunity to be a mother and a parent of two beautiful children and to be very active as a grandmother. But I can tell you, this is all hands on deck, whether you're actively parenting or not. This is about the future of our country and investing in our children. And those, I will give you this piece of advice. Those who say we don't need it, ask them why are they campaigning and why are they really trying to strip resources away from women and mothers and families in America, because that's what they're doing.
Absolutely. You're right. Thank you so much for joining us this night.
Thank you. You all take care now.
Have a great one. Thank you.
Okay,
take care. So just as a reminder for folks who might just be joining us, you are joining Raising Justice, which is a celebration and a call to action for our other mothers. This event is both a Tele-Town hall and a Facebook Live, and we are really grateful that you all decided to join us in this conversation today. There will be opportunities, like right now, to ask questions of our speakers and weigh in with your experiences with childcare via a poll that we'll have throughout the event. During any time, if you are on the phone with us, you can press 0 to be connected with an operator to ask a question. The operator will either take your question to share with us, or we will unmute you so that you can speak for yourself. If you are on Facebook, thank you so much for joining us. We have moderators who will be connecting you via, with you via the comment section. So make sure you ask your questions in the comments. Feel free to type anything that you have that you want to share with us, whether it's a story, a question, whatever it might be. And we'll make sure that we can get that asked live so that folks can hear what you're trying to say. We will also be taking polls to hear from you, your experience with childcare. I think we should actually start with a poll right now as we're waiting for questions. Again, if you're just joining us, we just spoke with Congresswoman Brenda Lawrence, who's been a champion for childcare and care as an economy overall, and we're super happy that we got a chance to speak with her. So I want to start with the first question from us. We want to ask you all who are in the audience right now to tell us a little bit about your experience. Our first question for the night, since we are talking childcare, is: have you had trouble finding or paying for childcare in the past year and a half? Again, if you're on Facebook, you might see a poll pop up in the comment section where you can answer there. And if you don't see the poll, please feel free to just put yes or no and whatever you want to share in the comments. And we'll make sure those moderators get that information to me so we can talk about it. And if you are on the phone, if you have had trouble finding or paying for childcare in the past year and a half, you will press 1 for yes and 2 for no. Again, if you have had, the question is, have you had trouble paying for childcare or finding childcare in the past year and a half? You're going to press 1 for yes and 2 for no. Again, we're having this conversation this evening because, like Congresswoman Brenda Lawrence said, they're working on the Build Back Better plan, which is a package that would have a lot of historically just astronomical investment in a lot of different things that really matter to most people in this country. Things like childcare, healthcare, things that really will get folks back to work, get us healthy and doing better than we've ever done before. we all know that anyone that's experienced the last year and a half, we know that there is no going back to normal. There is no normal that we want to go back to. We want to make sure that that we take this opportunity now to create new investments that actually speaks to what families need more than anything else. We've been serving the corporate good and we've been serving money for so long. Now it's time to start serving people. So to do that, we want to make sure that we have the opportunity to put investment and put our money where it really matters. And we think that has a lot to do with childcare. What we say in the industry that we're working in is that care work is the work behind all other work, right? Without having somewhere for your kids to go to work is impossible. Without having someone to care for your loved one, maybe an aging parent or someone with a disability that you're in charge of, work is impossible. So we know that we want to honor our caregivers tonight. We want to make sure that we are paying attention to their needs and actually building a system and infrastructure that's going to make sure that they can thrive just as much as the future of the children that we have them serving. Again, our question for the poll, if you all have anything to share, is one, have you had trouble finding or paying for childcare in the past year and a half? It's press 1 for yes and 2 for no. And if you're on Facebook, please share with us your experience as well. You can just drop in a yes or a no, or you can tell a little bit about that story and our moderators will get that information to me to share. It looks like on the telephone side, we're at 88% of folks are saying yes, they've had some issues, and 13% have said no. That makes a lot of sense because we know even before the pandemic, before childcare centers had come to a screeching halt and had to close their doors for safety, we had a lot of issues with childcare. Folks were not able to pay for childcare. Folks were not able to find and get access to affordable quality care of their choice. And those are some of the things that we're trying to change this time around. Again, Congress have before them right now the ability to invest $450 billion in childcare, and that could make a huge difference to a lot of families and a lot of providers here in Michigan and really across the country. And someone who can talk more about that and what it would really mean for Michigan is also joining us tonight. And I want to welcome her, tell you a little bit about her. Our next guest that we have coming to us is Kelsey Perdue. Kelsey Perdue is the Kids Count in Michigan Project Director at the Michigan League for Public Policy. She oversees data analysis and advocacy as part of a national effort to improve children's well-being. Kelsey also serves as a chair on the Grand Rapids Community Relations Commission and was appointed last fall by Governor Whitmer to the Black Leadership Advisory Council. She has previously led a political action committee where she helped mobilize thousands of dollars and hundreds of volunteer hours to support equity-minded political candidates and ballot initiatives, ultimately changing the political landscape in West Michigan. We're so thankful for you, Kelsey, and all your hard work. Kelsey has also been named 40 Under 40 business leader by the Grand Rapids Business Journal and recognized by the Link Up and the Community Spirit Award. Originally from Grand Rapids, Michigan, she's an alumni of Howard University and the Michigan Political Leadership Program. Thank you so much for joining us this evening. Kelsey, I want you to just say hello to the folks and welcome you tonight.
Hi, thanks for having me. Oriana, so great to see you again. I always enjoy conversation with you about the importance of this work. And yeah, I'm looking forward to speaking with your network and your mamas tonight.
Awesome, thank you so much. Just got another report in quickly before we get started. It looks like we have one question. Well, it looks like we had 86% of people who did say that they did have trouble in the last year and a half obtaining and paying for childcare. And another question that's coming from Facebook is, when will this money from childcare be released? I'll talk a little bit about that, and I'm sure you might have something to share as well, Kelsey. Or do you want to take that question, or do you want me to share a little bit about what I know?
You can start, and then I'll hop in.
Absolutely. So for those who are not aware, the Build Back Better plan is not the first chunk of money that we've gotten from the government. Ever since the pandemic started, Congress has continued to go on the Hill and have conversations around what it is that citizens in this country would need, from the shutdown to health and safety and everything that we would need to make sure that we stay safe and got through this pandemic as best as we could. A lot of that came out of that conversation and came out of those votes were funding for different programs, right? And childcare did see some funding from last year. There was the CARES Act, More recently, there was the American Rescue Plan, which Biden suggested, which actually got Michigan $1.4 billion in funding for childcare alone. And although that number seems ridiculously huge, it's not as big as we would think it is, because childcare in this city, this country and in this state has been for so long so underfunded and so underinvested in, that we're really coming from a place of crumbling, right? It's really a drop in the bucket to correct the problems of the past. So it's important to note that even though that $1.4 billion, which Governor Whitmer actually just signed into the budget, and has a really good plan for that Mothering Justice is actually supporting, we really are getting to a point where we can find ways for the community to have a real say in how that money will be allocated and how families can be supported. I know there's a lot of things that the governor and the administration has ideas around. They've been talking to community members, community leaders around what do we need when it comes to childcare? How can we correct this, right? And we want to make sure that you all have a voice and that you share your experience so that we can better educate folks who are making decisions with your money. We're excited to see what this investment can do. And we want to make sure that we have a say in how this money is spent. So for what I can tell right now, since the new budget was released, there is a ton of investment that's happening, and we're excited to see what it's going to do. But right now, the next thing that's in front of Congress is the Build Back Better plan. And like I said, that right now is promising $450 billion. And Michigan would see another, multiple billions of dollars to really create an action plan to really build the infrastructure for childcare that we really need. And that's what we want folks to be a part of. We want to make sure that y'all can say, this is what I've been wanting. I want to be able to have personal choice. I want to be able to utilize my mom or other family members so that my child is safe and feels comfortable. These are the things that I'm looking for. There's been a lot proposed, but that money is going to start getting released in a lot of ways very, very soon. So Kelsey, please share with us what you know a little bit about not only just the question that was asked, but can you tell us just a little bit, give us a little history, honestly, from your perspective of how Michigan has been doing when it comes to childcare, taking care of both kids and families.
Yeah, thank you for that. And you did an excellent job, I think, overviewing what's happening federally. So I come here today as part of the Kids Count Project at the Michigan League for Public Policy, and we focus on issues at the state level, including issues related to the state budget. And so childcare is something that we've been involved in for a long time now. And so it's really cool to be in a moment where there's a lot of action and a lot of wins and a lot of opportunities right in front of us, right? And so I'm so glad you all are having today's conversation and today's call to action event. So I'll give a quick overview of how childcare has not really been working in Michigan for providers, like as small business owners, or for families. And then I'll kind of touch a little bit about what the recent state budget, the $1.4 billion put into childcare here, kind of what it is doing for providers and for families. So you've already spoken to it. Childcare is really unaffordable in Michigan, right? So to be considered affordable, childcare should take up about 7% of a family's budget. But because of the high cost of care, if you want to put an infant or toddler in a licensed childcare setting, if you make around the median wage, like right in the middle of income earners in Michigan, that's going to run you almost 20% of your income. Let me say that again, 7% is considered affordable. But for the median wage household, childcare for an infant, toddler in a licensed childcare setting is going to run them 19%. So that's well above and beyond what we consider affordable. And for a person who is making minimum wage, that is going to take 55% of their income. So in Michigan, we know that the cost of childcare literally rivals mortgages and rents and college tuition. And so that is a huge problem. And that's not just kind of to my point for families who are considered to be in poverty, right? This problem expands really across a lot of different socioeconomic statuses or income or levels, but we know for sure it does impact our low and moderate income workers even more. So affordability has been a huge issue. So that's why the state has programs like childcare subsidies to help families pay for this really, really expensive childcare, right? But to your point earlier about investments in infrastructure, we haven't put the amount of money that we needed to put in subsidies, and or we've made policy decisions that have kept subsidies out of reach for families in need. And so one of the really big wins that came out of the recent Michigan budget passage is an expansion of the child care subsidy eligibility level. So that's a win. So on the other side, so that's kind of families, right? We know it's not really working for families. It's not affordable. And we all know why childcare is so important. It is an early learning environment. It is a safe space for our kids to go so that we can work, et cetera, et cetera, et cetera, right? So on the provider side, providers are small business owners, right? And so even pre-pandemic, many of them have been struggling, particularly those who might accept kids with subsidies. And that's because childcare, unlike K through 12, is based on people's ability to pay, right? Your ability to pay for first grade education, right, doesn't really dictate what type of first grade education your kid would get. But if you're talking about early education, childcare, infant, toddler, it certainly does. So for that reason, we see a lot of providers congregating in higher wealth areas. And so if you are not in one of those higher wealth areas, that is going to impact your actual physical access. And if they're not accepting subsidies, can also affect your access. One reason why providers might hesitate to take children with subsidies is because the reimbursement rate that they get from the state isn't actually enough to cover the cost of caring for those kids, right? So there's been a lot of challenges in our current system. I want to emphasize both on the parent and family side, but also on the provider side. And so we really need a solution that makes a system that works for everyone so that our families, our businesses, and our economy can all thrive in Michigan. I know that was a lot, but so I want to give you time to respond, and I can dive in or talk a little bit more about the $1.4 billion that we just allocated.
No, that was perfect. I think that was a great framing of where we are and where we can go with this investment. And I want to say a couple of things. One, we have a question from the audience, and I'll share that in just a second. But I really connected to what you were saying, Kelsey, around the 7% and the 20%. And for me, it's personal. I always think about I have a daughter now, a daughter who will be 5 in January, right? So she's 4 years old. And when I got pregnant with my daughter, Leilani, I remember it was like 2016. So clearly way before the pandemic, right? And I remember working at the time 3 different jobs. I was working in the call center, I was working out in Somerset at Pottery Barn, and I was working at a childcare center in Northfield. Now this was a center that had, what do you call that? When it's like multiple centers, it was like a franchise, right? And I was making, again, working 3 jobs at the same time and finding out that I was pregnant. I was working there and I was making about less than like maybe $175 every 2 weeks. I was getting paid $9 an hour to work there. For the hours that they had to offer me, my checks looked like $175 every 2 weeks. And I remember when I was about 3 months pregnant, I went and talked to my director and I'm like, hey, this is happening. You know, my family's expanding, blah, blah, blah. This is my first child. And I remember her coming to me and saying like, oh, Oriana, this is great. You had the opportunity of actually getting half off your tuition here at the center. So you can be working and your child can be here and it'll be the best of both worlds. And I remember looking at the director, because at the time to bring an infant into that center, which the infant starts at 6 weeks for that particular childcare center. And I think most of them, it was $1,600 a month. $1,600 a month for a child that was 6 weeks old for you to bring that child to the center. And I'm like, lady, you don't even pay me $800 a month. Like, how am I going to be able to afford this? And I'm just like, it's hilarious to me because again, I was working 2 other jobs and I still wouldn't have been able to pay at the center that I was working at. And that's all too often the conversation in the struggle that a lot of childcare providers have to deal with, right? I think it's that most childcare providers are on state aid, not all obviously, but for what the wages that we're paying childcare providers and early educators, they're in desperate need of utilizing a lot of the systems that they're helping families navigate. So using SNAP benefits or using Medicaid, whatever that might be, childcare providers don't make enough money to be off of those systems. And I just think it's ridiculous that we're asking folks to do this very important labor and choosing to pay them nothing. But I want to go to a question before.
Wait, can I respond to that?
Yes, please do.
Because, when we think about value, we kind of have this idea that the more valuable, a certain role or job is, the more that it pays, right? But if you look at our education system, and if you consider the science of brain development, that 0 through 3, 0 through 5 early years are the most critical components of the most rapid kind of brain development, right? Rapid period of brain development. It is so important to really set the foundation for future learning. But yet, our early educators and our childcare workers are are the lowest paid educators, right? So if you had like a chart of how much folks are paid in our education system at those early critical years get paid the least, and kind of those college years usually get paid the most, right? So it's a really backward system in that way. And though we know that childcare is expensive, we kind of throw out some numbers. It is not because, to your story, because the childcare workers themselves get paid so much money. That's not the reality. So there really are some structural concerns and things in the system that is not working. There's no way that folks who have this really, really critical role in our economy and in our families and our communities should not be able to make enough to make ends meet or to provide or pay for care for their own children. And you're absolutely right. A lot of childcare workers have to take advantage of state support and our safety net systems because, quite frankly, they just don't make enough in their wages. And so, and particularly for care centers that do accept children who have subsidies, which is so important, right? To make sure that everyone has access to this early care, especially quality early care. Like I mentioned, the state currently what the state reimburses those providers for working with those children on subsidies isn't enough to actually cover the cost of care. And so sometimes you see providers losing money, right, by accepting those. So that's been a big kind of solution that advocates have said, we need to pay providers. And so in this budget, we see some money going to childcare grants, over $700 million going to support new or expanding childcare businesses to help them stay afloat. We have money for startup childcare businesses, and there's also money being allocated to provide bonuses to childcare workers. Now,
I'm sorry, I don't mean to interrupt you, Kelsey, but I have some people are really feeling you because I got some questions for you, and I want to make sure
okay.
This is super interactive, so I want to make sure you all have space here. Again, I just really quickly want to say, I want to actually give a shout out to Shanice, who's watching on Facebook. Thank you, girl, who's the other mother. Appreciate you joining us. And also, I have a question from Simone, who's actually on the phone, and I'm going to ask the question for her. So Simone is asking, will childcare funding be accessible, for women who have exceeding income limits? Will they update the threshold for folks who are slightly above so that they will qualify? And I have a backup question, but I want you to speak to that first.
Yeah, so to be eligible for a child care subsidy previously, most recently, you had to be at 150% of the federal poverty level as a family of 4. So that number changes based on like the size of your household. But let's say family of 4, that's about a little bit under $40,000 a year. With this current budget that's gone into effect October 1st, that eligibility threshold has been risen to 185% of the federal poverty level. So that is equivalent to about $49,000. So the income eligibility has jumped about $10,000. So that is good. However, Michigan still has one of the lowest subsidy eligibility levels in the country. The national median is about 188%. And what we recognize to be best practice is to be at 250% of the federal poverty level to be eligible. So we went from 150 to last year. We just got up to 185, and we want to really keep going to that 250. So thank you for that question. It is rising, and I recognize that that's probably not fast enough for kind of all the folks who are in need, because this really is a huge challenge. So thank you for that question.
Thank you so much, Kelsey. And Simone's second question is, will mothers who are in rehabilitation from drugs or criminal charges or dealing with CPS in any way have access to the new funding?
I am not sure all of the state's requirements to receive childcare subsidies. I'm not sure how that may or may not factor in. That's not something that's been on my radar. So I would encourage you to apply and or to kind of get with the community navigator to help you kind of understand those specific requirements before going through the process. I do, though, have to say, you know, all honestly, I think sometimes the eligibility for some of these programs isn't fair or isn't as relevant as it could be. So for example, so even outside of the eligibility level, right? For some programs, including childcare subsidies, if the parents do not reside in the same household, one condition of compliance or one condition of being able to receive that subsidy is that the parent who isn't in the house has to be compliant with childcare. Sorry, not childcare, child support.
Yeah.
Which I don't think is necessary. It proves another barrier. And we know that a lot of parents who don't reside in the same household have informal arrangements and that might not want to go through the state process of child support. So I do know that is a real barrier to folks who might be eligible and in need of that subsidy. And I think that is another opportunity to share your story with your state representative and your congressperson to say, this is not good, right? And this is harming us and making it harder to access the support that's so critical and necessary for us, especially right now.
You're absolutely right, Kelsey. And I will say that I know that advocates in New Mexico actually got rid of that. They had that same law that the parent outside the household had to be on child support, and they were able to really rally and advocate and got rid of that law. So I just want folks to know that that is something that Mothering Justice is absolutely thinking about. There are a lot of barriers and a lot of unnecessary obstacles to attaining a lot of the supports that families desperately need. And we're doing that work, and we want you to share your story and experience so that we understand what are the things that we need to be advocating, and we can teach you all how to advocate for yourselves. I have one person who's waiting to ask you a question. I know you have to go, but thank you so much for this time. I want to give space to Jayla from Detroit. She has a question that she wants to ask. Are you still with us, Jayla?
Yes, hello.
Hi, how are you? Thank you so much for joining us tonight.
Thank you. I'm doing well. So my question is, I've done some research about other countries that do free childcare for everyone that lives there. And I was wondering if that is something that not only the state of Michigan would be open to doing or is looking into doing, or if it's, but if it's also something that this organization is pushing for.
That's a great question. Oh, did you want to go ahead? Was that Kelsey or Jayla speaking? I'm sorry.
That was Jayla, sorry.
Okay. Yeah, so I know that there's been a lot of stuff happening on the federal level. We've been talking a lot about a universal pre-K, and that's like that giving access to any children that are 3 and 4 years old to have some form of pre-K. And we know a lot right now, especially in Michigan, a lot of pre-K centers are inside of like public schools. But we know, again, like even the things that are proposed around universal pre-K still don't really meet the mark for what families really need. So I think something that Mothering Justice is focused on, the way we see childcare, is really 0 to 13, right? And we say 0 to 13 because honestly, childcare goes beyond just that pre-K age. It's really about after school, right? After school programs for school-age children, summer programs for school-age children. How do we make sure that families have full support all year round, and not just thinking about just the 0 to 4, it being the family responsibility? So I think that's a great question. It is something that we're looking into. It is something that we're advocating for. Honestly, it just really comes down to making sure that we have your voice and your experience so that we know what families really need, and we know exactly what to put in front of our legislators to make the best policies possible.
I would love to see a day where we wrap in early education into kind of our public education system, right? So K-12 education is free for all unless you choose to go private school, tuition-based, but it is a free, available quality option for all. But that's not true in early education and childcare. A lot of it really does depend on your ability to pay. And so I would love to see the day. And I think, you know, when we first heard that $1.4 billion was going to come to Michigan, we dreamed and we said, how can we totally reform this system and say, yes, let's make early education and childcare a public good because it is part of that learning continuum, right? Learning doesn't just start in kindergarten. We need those early years of quality learning and development to prepare our kids to do well in school and life and beyond. So thank you for that question. I hope we can get closer and closer to there. But to Oriana's point when I first got on that, it is going to take a lot more than $1.4 billion to do that. Unfortunately, as we talk about programs and we talk about solutions, they do have price tags, right? Which is fine. And right now we do have limited dollars. And so we as a nation and as a state need to decide how we want to prioritize that. And I say, let's invest in children and families.
Thank you, Kelsey. And I know you have to go. We have one more question that you might want to speak to very quickly. I see now it's almost 6:15, so we want to make sure that our last speaker has a chance to share her experience and her story. But Goya Diaz from Facebook is asking, will informal childcare providers qualify for some of this new investment and how we're going to be able to support and stabilize childcare providers?
I don't want to give you a for sure answer because I think there's a lot of different programs. There's a few different grants and bonuses, and I'm not familiar with the administrative and application processes of each. I do know that, especially for the provider grants, there are rubrics that can give you a little bit more money if you work with infants and toddlers, for example, if you're open during like evening and weekend hours, kind of those groups and those times that can be really, really hard to find care. So my good gut guess is yes. I think the state recognizes the importance of informal care and family friend and neighbor care as we talk about childcare affordability and availability. So I would encourage you to apply and learn more information and we can help with any follow-up, Oriana, if that's helpful.
Thank you so much, Kelsey. We'll definitely connect you and ask you for your help. So thank you so much to you and the league. Again, we have with us Kelsey Perdue, who is a wonderful, phenomenal child advocate over in the West Michigan area. Thank you so much for joining us tonight.
Thank you. This was fun. Y'all take care.
Have a good one. Thank you. So again, this conversation is interactive. No matter how we're going to do it, we're going to get it done. I really want y'all who are on Facebook to still put in your comments, put in your questions into the chat. And if you are still on the phone with us, again, please, if you have a question that you want to share and get asked, you're going to press 0 on your phone. But let's go ahead and do a quick poll before we introduce our next guest. Our next question that we want to hear from you all is, what type of childcare are you using? Again, if you're on the phone, it's going to be, I want you to press 1 if you're using a facility or center-based care. I want you to press 2 if you're using in-home care, and that can be in-home smaller center that has the smaller amount of children. That's a license-based center in-home. And if you are using our other mother or informal care, I want you to press 3. Now, the last question was around informal care providers, and I want to share with you all that our other mothers is a term that Mother and Justice coined to represent those informal providers, those friends, those families, and those neighbors that really care for us and our children and allow parents to do the work that they need to get done. It's almost impossible to be there 24 hours a day, right? If you're working, if you're going to school, doing all the things that you have to do, there's someone that we trust and that we depend on to care for our children. And here at Mother and Justice, we call them our other mothers. They're angels sent from heaven that we need to get a break or to get some relief and to get a lot of support. And so we want to know, are you using other mothers or informal care? Press 3 for that. Are you using in-home care? Press 2 for that. Or are you using a center, a big facility somewhere close by your job or close to your home? You would press 1 if you're using a center. Now, I want to introduce, and please feel that, continue to post that in the chat and we'll get that information and we'll share that out. But I want to go ahead to our next speaker. I'm super excited that she was able to join us this evening. I want to go ahead and invite our next speaker and our last speaker for the evening, Lauren Franklin, to the conversation. Again, Lauren Franklin is actually a registered nurse and a friend of mine who is newly divorced and aspiring to be a CRNA. She has been adjusting to her new life with her, and with that, her dad has been kind enough to move in with her all the way from Georgia to help out with the care of her son. Welcome, Lauren. Thank you so much for joining us tonight.
Thank you. I'm so excited. And I just want to say too, actually, the day before I came, I had to go back to work on maternity leave. My mother had moved in with me as well from Georgia, because she was like, she wanted to make sure that no one else was watching this brand new baby. This was like my first one, the first grandbaby. So it was literally all hands on deck, from my mom to my brother to my sister to my father to my friends. And I'm just forever grateful. So I'm really, really, really part of the Other Mother Club 100%, though I am. My son, he is in a facility as well, but for me to expand and do what I need to do in life and give him the greatest that I can in life, I'm using both. I have to do both.
Absolutely, Lauren. I think that's a big thing that we talk about here at Mothering Justice, is that there is no one type of care, right? And I think oftentimes legislators and policymakers think about it as that, oh, we want to think about what's licensed, what's regulated, what can we control, what do we know, what's happening? That's a license center, right? And the end all be all of it is that that's going to be impossible, right? At any given moment, because of the lack of funding in childcare, there aren't a lot of centers that can actually be open 24 hours a day, right? 7 days a week. There aren't any centers that really can to accommodate and integrate children who may have disabilities in with children who don't have disabilities, right? It takes a lot of money and a lot of funding to support centers that could really support families the way that we need them to. And even though we love our licensed providers, we know that with or without funding, with or without structure, like, children are always going to have to be cared for. And oftentimes families depend on their other mothers, right? Their friends, their families, or their neighbors to take care of their kids. And a lot of times that's what they choose to do because of lack of funding, right? They might not be eligible for the subsidy, or they might not have enough money to pay for certain centers. But a lot of times it's simply that they're using both, kind of similar to your situation, or it's just their personal choice as a family. No one's going to understand you or your values and what's important to you and how you want to raise your son like your parents, right? They raised you and they're going to listen to you and they know exactly what you want. So I think it's important to acknowledge that other mothers aren't going anywhere. We've always used them, we'll always need them, and they really do support the care industry as a whole, right? They're going to always be a part of, be in tandem and be in relationship with licensed providers, be the support for folks who are dependent on licensed providers in more traditional hours. I know for you, you work midnights, is that right?
That's correct. I work 7 p.m. to 7:30 a.m.
Right. And so for me, I don't know too many centers, especially in the Detroit area, that has 24-hour daycare, right? So what would you have to do as a parent to get childcare if you didn't have an other mother?
So originally, my ex-husband and I, we will be on opposite schedules. But even with us being on opposite schedules, at times it would be a gap, like a 2-hour, 3-hour gap, to where we may not have had someone to watch our son. So my mother or my sister, especially before COVID, would come over to our house at like 2, 3 in the morning, like right before we needed that coverage, to stay over and help us watch him. So I was very appreciative of that. And my family would just rotate. And even now, it's just still a rotation, because I'm still on midnights, and my ex-husband, he's like on his opposite schedule still. And they are extremely supportive. And sometimes my mom drops off our son to school, so the teachers know my mother, they know my father, they know my sister. There's a list of people. And I actually have a friend too. Our sons go to the same school. So even like yesterday, I was extremely tired. I had a lot to do, and I've worked 3 days in a row. Sometimes I'll work 4 days in a row. And they're just there. They say they'll pick him up. And I have more gratitude for my other mothers and the centers than anyone will ever know. It's legit a village. It's a village. And with me becoming a CRNA, unfortunately, for 3 years of my life, I won't be able to work, and it'll be all school based. And I'm really going to depend on my other mothers and the center.
Absolutely. I think that's really important to know, right? I think so often we hear a rhetoric from folks on really both sides of the aisles talking about, like, we got to get folks back to work. We got to get folks back to work, or folks don't want to go to work, and that's why we're not going to pay for childcare, whatever that might sound like, right? But a lot of times I think it's important to hear stories like yours, because at the end of the day, you're a registered nurse, you're making good money, you're doing all that you can for your family, like all of us are. We're doing the very best that we can, no matter where we are in the world. And where we are in our journeys, we're doing the very best that we can. But as you continue to expand yourself and grow so that you can continue to do more and have more to offer your son, you're going to need that support. That support is still very much there. And it's important to think about the fact that it's not just about folks not wanting to go back to work. Like, you're going to be able to go to school for 3 years.
too, even with, I'm sorry, excuse me, but even with the situation of the pandemic happening right now, they need nurses. And it's been multiple times where my manager begs me to come into work, and I'm like, I can't do it because I don't have anyone to watch my son. So I feel like I'm failing other families on top of that because the
Yeah.
nurses are needed.
Yeah, that's heavy to think about being in the medical field in the last 18 months. It's been really hectic, and to have to go into work and still come home. And I think it's an absolute wonderful thing that you have that support system to be able to watch your son. Because I know sometimes you can't even be, I know you said you were a traveling nurse at some point. You can't even be there for your son at all, or you can't come home because of COVID or things like that. So it's just definitely important that we support other mothers and acknowledge that if folks are going to change their lives to be able to be there for their family members, they deserve not only some type of financial or funding support, but also other recognition or other support to make sure that they're a part of this workforce as well. But before we continue, Lauren, I have a couple questions. So we'll start with Facebook. It looks like the Detroit Parent Collective has a question. And I like what they're bringing to the table. It says, would you consider a cooperative approach an informal provider? Are we included in the conversation as well? And for what I know about cooperatives, I'm really interested in them. I think I need to learn more, but I'm thinking about some certain systems that are created where I know, like you work in a hospital, right? So you have to be in a hospital the entire time of your shift. But me, I have been fortunate enough to work from home since COVID started. And so different cooperatives that exist, like the Detroit Parent Collective, is a space where parents can actually come with their kids and share working space. Like right now, I don't know if y'all can tell, but I'm actually in a shared working space because my internet at home sucks. So I'm actually in a shared working space where I could be doing the work that I have to do, focusing on my own job. And there are other folks outside that door that are doing the things that they're doing for their own businesses or other jobs that they may have, right? And so a cooperative is a space where you can come and do the work that you need to do. There's Wi-Fi, there's everything, all the amenities you would need at your job, but there's also a space for children, right? And a lot of times, a lot of moms who are working and momming at the same time. I know in the last year and a half, it's been so crazy. And right now I'm so thankful that school is open, and like my daughter is in pre-K now, so she's not home anymore. But when her childcare center closed down, oh my God, it was so hard because honestly, it felt like neglect. My daughter hated the sight of my laptop. She hated to see mommy working at home. She just didn't understand it. And she would literally walk past my computer and like slam it down, like, no, it's time for me. It's cuddle time. And it just would break my heart, right? It's really hard sometimes working in a place where your children are very used to being, family time. And so I think a cooperative where moms and other caregivers can step into a space that is work focused and allows us to stay focused, but also accommodates our children is a really great option. I do consider that to be other mothers. I think that is a space where actual mothers can support each other, right? And get their work done and also be able to care for their kids all at the same time. So I think that's an awesome addition to kind of this wonderful dynamic that we have going on, thinking about all the different types of care that truly exist.
Well, the interesting part about that, though, I do know and understand in one of the facilities that I work at downtown, they actually used to have daycares for mothers who work midnights. It was in the hospital. And I'm honestly not sure what happened, but they said it was so great and it helped the hospital as a whole. But for some reason, they took it away. And I'm not sure if it was the funding. I didn't go deep into it, but I just found it so interesting how they used to support us in that manner, but like I said, it was taken away.
Imagine what it would be like, right? Imagine what it would be like if you could take your kid to work and your kid goes off to school. That happens at Grey's Anatomy. I watch that show a lot. And they have like the childcare center right in the hospital. And I just think, how easy would that be to be able to quickly get to your kid as quick as you can, but still be able to focus on work. I think that's a wonderful way to start to envision what are all the possibilities for how childcare could really look in this country. But we're nearing closing time. So I want to just take a pause for just a second. Again, I want to remind everyone that this is Raising Justice, interactive conversation, right? Both on Facebook Live and on the telephone. If you are still with us on the phone, and if you are with us on Facebook Live, if you have any questions, please feel free to either drop them in the chat, or if you're on the phone, press 0 to ask a question. Operator will connect you to ask for yourself, or you can just let them know what your question is, and I'll read that out loud for you. We have one more poll for this evening, and then I want to share a little bit about what it is that Mothering Justice is working on and why we're truly here and why we want to make sure that folks know exactly what's at stake right now. And then we have an ask of you all. So my last poll question here is, has access to affordable childcare options ever caused attendance issues that resulted in job correction or in corrective action at work or job loss? I'll read that again. Has access to affordable childcare options ever caused attendance issues that resulted in corrective action or job loss? If you're on the phone and you've experienced job loss or some type of corrective action because you couldn't get childcare, you were late, or something happened where you had to call off, I want you to press 1 for yes. And if you've never had trouble with that and your job has been pretty flexible and you haven't had that problem, I want you to press no. Again, if you're on Facebook, please let us know. Have you had any trouble with your job because you weren't able to afford or you weren't able to access childcare? Yes or no? Press 1 for yes and press 2 for no. But I want to talk a little bit more just because we've kind of like started this conversation, Lauren, of just like dreaming of what are the possibilities, right? How can jobs be supportive? How can the government be supportive? How can families support each other? Thinking about the collective question, how can mothers support each other, right? Because we depend on each other so much. One of the things that Mothering Justice has been working on is our other mother support hubs. And what that is that we had conversations really most longer than the last 2 years. We've been talking to folks who, like you, depend on other mothers, right? Depend on your family, your friends, or your neighbors to help with childcare. And we really wanted to figure out, one, why you're doing it. Is it just out of just easy access? Is it out of affordability? What are the reasons for it? And then we've asked folks to actually connect us to our other mothers, like your dad and your mom and your sister, and kind of figure out from them what their motivation is. Why are they doing it? And in those conversations, we learned a lot. We learned a lot about why families are taking care of families and why people are stepping up to the plate to fill those gaps. And I think it's important, some of that information that we got out of those listening sessions was that we really need to decide that this is actually a real workforce, right? That people have to do this work, not only want to do it because they love the children, but they have to do it. Yeah. We really can't survive without it. And so we wanted to introduce the work that folks are doing kind of informally on like an invisible level to the state and to the federal government as, hey, there's a whole workforce of people who are doing this work and they will no longer be invisible. And so some of the things that we brought to the state, and we are in conversation with the administration and other state agencies, is that we start to consider other mothers as a part of the workforce, right? There is a program here in Michigan where you can be license exempt, meaning that you are other mother, but if the family that you're serving does get the state subsidy, which from some of the stuff that Kelsey talked about today, we know a lot more families will have access pretty soon once that $1.4 billion in funding starts to move into the programs that it really needs to be in. If the family you're serving has access to the subsidy program, the state, you can be in contract with the state as an unlicensed person to provide care for that child or those children. And so we looked up the system for the license exempt program, and we understood that it just doesn't make any sense, honestly. A license exempt provider is being paid $1.75 an hour to care for a child. Waitresses are making more money than that, right? And I obviously the service feel is really important, but thinking about someone who's like taking care of a child 8 to 10 to 12 hours a day, making $1.75 an hour, I mean, it's barely enough to feed them their snacks for the week, right? It's just not real income. And so what we decided is that we need to kind of look at the system that exists and allows people to be able to use those other mothers, but also figure out what we need to create a system that would be more attractive to other mothers, right? That would pull people in and get more support. And so we've sent a set of recommendations to the state in which we suggested that we need to, one, do a pay increase, a wage increase for the other for license exempt providers, also provide wraparound services of support, right? So if a child is being cared for in a home, how do we make sure that that home has access to the internet? How do we make sure that home has access to developmentally sound programming so they're getting support when it comes to curriculum? How do we make sure that these unlicensed providers have the same access to support and care that licensed providers do, right? Because they're gonna do the work without the government, right? And we want to make sure that folks acknowledge that that work is happening and that we create the best infrastructure and the best support for those folks as well. And so that's some of the work that we've been working on. But I see here Oh, we have 100% right now. 100% folks on the calls have said that they have had access, but that having access to affordable childcare has caused issues at work, whether it be job loss or corrective action. And it looks like, and it looked about 90% of folks on Facebook as well. 57% said yes and 43% said no to that final question. I'm sorry, 57%. Thank y'all so much for answering those questions on Facebook and on the phones. But before we go, I'm so thankful that y'all have stuck around this hour to talk about childcare. This is a huge issue here in Michigan. And honestly, we're at a place where we really have a lot of power to change what's happening. Again, if you're on Facebook, you should see some things in the comments that that talk about you can see a link in the comments. And if you're on the phone, I'm going to share with you what we want you to do next. But I think it's important that now that we've learned some things together and we've had some important conversations and dialogue, that we really get to the bottom of how do we actually participate in making sure that what we need as a community actually happens, right? We have the power to make this change. We're not just waiting for elected officials to make these decisions for us. We have to share with them our experience, raise our voices, and make sure they understand this is what we need. This is what I like. I like a cooperative sometimes, and I like an informal provider sometimes, and I love my facility. I love it all, and I want it all. And I think parents have to be able to stand together and fight for that, and providers as well, to make sure that they're getting a living wage and everything that they need to thrive. So we want you all to join us today. We want each legislator, community member, partner, and all of our viewers tonight watching to support investment in childcare. We know that it's going to take all of us and all of the funding that we can get to really create a system that's going to make sure that folks can get back to work, join the workforce, or even join a new entrepreneurial journey, right? Again, I think it was both Brenda Lawrence and Kelsey who spoke about how childcare centers is a great avenue for a lot of women of color and BIPOC women to actually create jobs for themselves and in their community that they serve, right? That's an entrepreneurial journey. And so it's important that we all play a part in supporting folks to get back to work and create jobs for others. So we want to generate change. And to do that, we need you all. Our work is fueled by stories like the ones you heard here today, and even the ones that you may have inside. We want to encourage you all to share your stories with us, to elected officials today and every day, until each Black, Indigenous, and mama of color and caregiver concerns are heard and legislation reflects that change. So again, I want you all to click that link. It's the phone to action link. It's super easy to do. If you click the link on Facebook, it takes you right to an option to call your legislator. It dials, it does everything for you. All you have to do is, this time around, the offices are closed, but you can leave a voicemail and let them know. The system knows how to connect you to your actual congressperson. So your 2 senators will show up and also your representative, depending on what district that you're in, and you can leave a quick voicemail. It's literally less than 3 minutes of work. I think it's important that we take this conversation from Facebook and off the phones and start talking to legislators so that we can make sure this happens. Please click the link that's in the comments to make sure you can share your story and demand $450 billion be invested into childcare in this next package. And if you're on the phone and you want to share and talk to your Congress member, at the end of this call, I want you to press 7. Again, to talk to your Congress member, if you're on the phone with us, dial 7 and you will be patched through to your Congress member to leave that voicemail. We know that it's going to take all of us to take action together. Brenda Lawrence has said it, Kelsey has said it, I'm saying it now, and I know Lauren agrees. We need to make sure that they understand that there are so many different options here, right? We have so many different needs that we have, and we want to make sure that they know exactly what we're looking for. So as they're allocating new funding and they're creating new policies that are going to create the programs that will serve us, that we have a say in what those programs look like. So please, call Congress by clicking the link or dialing 7 on your phones right now to share with them why it's important that they invest in childcare right now. Childcare cannot wait. We can no longer wait. We can no longer take a backseat and allow others to make decisions for us. We have to have our say. So I want you all to share with us today, have your say, and leave a message for your Congress members, because they work for us, right? That's their job. Congresswoman Brenda Lawrence said it best. And she knows that she's here to champion the issue because people in her district need it most. And so she's serving the women that she's supposed to serve. And she's doing that by talking to her colleagues on the Hill and making sure that we get that full $450 billion of investment so that we can dream together and create the infrastructure and the support and systems that we need to make sure that all families and providers are supported. I want to thank you all for listening. I want to make sure, Lauren, thank you. Thank you for being here this whole time. I appreciate you so much, Lauren. Thank you so much for sharing your story and your experience. Again, click the link and share it with your legislator to make sure they understand how important it is that you still have an option to support your father as he moves in with you and support you on your dreams to become a CRNA and also to help take care of your son. I want to thank you all so much for joining us tonight. I have a shout out for Dominique on Facebook. Oh, Oriana rocks. Thank you, girl. I appreciate you for filling out that 450 billion reasons. Again, there's a link both to call your legislator. There's also a link in the chat to leave to share. We're going to send this to legislators as well, but it's there's a link to share with legislators again why childcare is so important and why they need to make sure the full investment of $450 billion, no less, is invested into childcare in this next package. I want to thank you all so much for joining us tonight. Please feel free to reach out to Mothering Justice. We're doing some amazing work here. Thank you so much. It's motheringjustice.org. Again, my name is Oriana. You can reach me at oriana@motheringjustice.org if you want to join the fight to support childcare investment and build the future that our family, our children, and our providers truly need. Thank you so much for joining us tonight. You all have a great night. Hug your family members, hug your kids, and hug your other mothers. Thank you so much.
Thank you.